One of the concerns right now, the variant of COVID-19, the new and more contagious variant that more easily spreads that was originally discovered in the UK. We know it's here in Canada already. Just over a handful of cases have been confirmed so far. CBC News has learned that an Ontario couple are the first two Canadians diagnosed with that new strain, and they are now facing charges over their failure to cooperate with public health authorities. CBC News investigative reporter Jonathan Gatehouse has been doing the reporting in this. He's live in Toronto with the details that he has learned about the first two cases. Jonathan.
Good morning, Heather. Well, what we've learned, Heather, is initially when the Ontario Ministry of Health released the information that the variant had been confirmed in Canada on Boxing Day, they said that these cases were a couple from Durham region, just outside of Toronto, who had no known travel history, exposure, or high-risk contacts. Then the following day, the ministry released another statement in which they said that after further investigation, they determined that the couple had indeed been in contact with a recent traveler, and they emphasized, which was new information and had not been provided in earlier interviews. And what we've learned since is that this couple, who have not been named publicly, are now facing charges under what appears to be the Public Health Act, because after testing positive, they did not disclose repeatedly to health officials that they'd had close contact with a traveler from the UK.
These were the first cases, as we've said, of this new variant in Canada. So if the couple, Jonathan, did not admit to contact with someone who traveled from the UK, how did public health authorities know to test them?
Well, in short, they didn't. It was a random test that discovered the variant that comes from the UK. Canada has been doing a small number of these tests since the beginning of the pandemic to watch for new variants. As worries about the UK strain intensified, they ramped up this procedure. And once public health experts got the results back, then they were able to go back to this couple and confront them with the information and eventually uncover the truth. It's a very small number of tests, positive COVID tests, that have been subject to this genetic sequencing, about 5% overall so far. So Canadians might assume that they're screening, but that's not the case.
Again, coming back to this point that it seems to spread far more easily, Jonathan, this new variant. Is this one of the factors behind, or could it be one of the factors behind this recent spike in case numbers in the country?
It's hard to say, but we do know that provincial modeling in Ontario suggests that this new variant could become the dominant strain by the end of February. And the big concern here is the time that it takes for case numbers to double. And with the current COVID strain that we've been dealing with since March, it's about 40 days right now to see those numbers double. With the variant, the modeling suggests it could be 10 to 15 days. We spoke to Amir Adaran, a professor of law and medicine at the University of Ottawa, and he put it like this.
I'm afraid the news isn't good. The new strain is 50% more transmissible than the strain that we were dealing with last year. And so if 2020 was a house cat epidemic, 2021 will be a cougar epidemic. It's just a more aggressive virus.
So the federal government, in reaction to this variant, did halt all incoming flights from the UK before Christmas, but those flights resumed last week. And while you do need a negative COVID test to get on the plane to come to Canada right now, there is no screening for this new variant.
Jonathan, thank you very much. We'll talk about this, too, in more detail with Dr. Bogosh ahead. But Jonathan Gatehouse, part of our CBC News investigative team.